Our whole mission is improving the standard of care for women in their post-reproductive years. This has been incredibly underserved for so many years. Traditional physicians don't receive any kind of menopause training, and so we're bringing specialists to a domain of women's healthcare that just women really haven't had access to. Angelo, I'm the founder and CEO of Gennev. You know, I was in the tech industry before I came into healthcare for a long time, and in various roles. And one part of what I was doing was focused on kind of our corporate women's network. And I noticed that women's health was changing and women were leaving the workforce. And basically, I started Gennev based on a gap in women's health care around post-reproductive care and menopause needs. So Gennev is an online provider for menopause and post-reproductive care for women. We have 94% efficacy rate in our treatment, and we provide telemedicine as well as health coaching services for women as they go through this hormonal shift in life. We're serving patients in all 50 states, and we have a team of clinicians, which are OBGYNs, as well as health coaches who are nutritionists. You know, I think most importantly, we are starting to measure health outcomes. Our whole mission is improving the standard of care for women in their post-reproductive years. This has been incredibly underserved for so many years. Traditional physicians don't receive any kind of menopause training, and so we're bringing specialists to a domain of women's healthcare that just women really haven't had access to. And through this, we're really proud of the fact that 94% of our patients report an improvement in their symptoms as a result of working with our providers. You know, I think post-reproductive care in menopause starts with talking to a provider, but there's so many more aspects of a woman's life. Menopause is kind of the kickoff to the second half, and so as a woman grows older, not only does she need hormonal care with an OBGYN and to manage those kinds of symptoms, but she also needs treatment around heart disease, bone health, brain health, autoimmune, and so we'll only add additional care capabilities onto our provider network as we grow over time. You know, a typical story that we hear from women all the time as they go into perimenopause is they can't sleep, they've got extreme mood swings and anxiety, and they're gaining weight. And so they typically go to their primary care physician, and that physician, not having any experience in menopausal care, may just diagnose them a sleep medication, depression, something for depression, and they're told to lose weight. And it doesn't really address what's at the core of what a woman's experiencing, which is perimenopause. And so the alternate solution, and what we feel is the best form of treatment, is for a woman to talk with a menopause specialist for a 30-minute appointment, and from that appointment, that specialist can understand if prescription care is right for her, oftentimes hormone therapy, as well as lifestyle change around nutrition, fitness, mindfulness, and sleep. And in that way, you're addressing the core symptoms that a woman's experiencing, and we just hope to change this one woman at a time.